In our Health Watch here at 4 o'clock, about 10,000 children will be diagnosed with cancer this year in our country, and the life-saving treatments they receive can be incredibly challenging, especially for kids. So here's one little girl's story.
Here she is.
4-year-old Bridget has spent much of the last 15 months at a specialty cancer center receiving treatment for a rare childhood cancer called rhabdomyosarcoma.
This has been going on for, a third of her life. But, she pretty much does it all with a smile, and she's just really brave.
She started chemo right after diagnosis, reducing the tumor so doctors could remove it. She also needed 6 weeks of radiation, 5 days a week, which for children often requires sedation.
The most important part is that that child is staying still, because if any sort of movement, the radiation will go in the wrong spot.
Sedation means anesthesia multiple times a week, with fasting starting the night before. It also means more time at the hospital.
Ooh.
But certified child life specialist Sydney Sanford helped Bridget avoid all that. Armed with toys, she's a friendly face for young patients, making it all less scary. Nobody can be in the room with the patient during radiation. Sydney wanted to see if Bridget would be able to avoid being sedated. She gave her a pair of noise-canceling movie goggles.
She picked out Barbie to watch. I always say, stand like a statue. And so they'll lay down like a statue, and she did great.
Sydney was just a rock star, kind of like calming her down.
The hospital says she's one of the youngest patients to receive her radiation without sedation.
They call her Bridget the Brave, and she's most definitely brave.
And Bridget's doing great. She's in remission and finishes chemotherapy next month.
Isn't it so tough to see those little kids, and they're so brave, they're so strong.
4 years old.
Yeah, the American Cancer Society says that childhood cancer rates have actually risen just slightly over the past few decades, but they've got these great technology advancements to help a lot of the kids. But unfortunately, those numbers aren't going in the direction we'd like them to see.